Hey, Tom.
Yeah, John.
I heard today that you want to expand Obamacare.
Actually, what I want to do is expand Medicaid.
So what's the difference between Medicaid and Obamacare?
Well, Medicaid is health insurance for poor people, while Obamacare is a structure, a framework, if you would, to help people buy health insurance.
Okay.
So on one level, people get Medicaid because they're poor. And on the other level, they buy insurance through Affordable Care Act.
That's right.
That's the difference?
That's right. Medicaid
Okay.
covers people that are below a certain income level. The Affordable Care Act provides a framework for people to purchase health insurance. What we have a problem is this gap in our state, above Medicaid and below the Affordable Care Act.
Oh, so at a certain level, you can't buy Affordable Care Act.
Below a certain level, you can't buy Affordable Care
But you
Act.
make too much to qualify for Medicaid.
That's correct. This is what I refer to as the working poor. People working 2, 3, 4 jobs that doesn't provide health care.
Okay.
So how do you pay for it, the expansion of it?
Well, that's a good question. I think it's something we need to pay attention to. But it's really pretty simple. We're currently paying for it. We pay for it by taxes that we send to Washington, D.C., and there it is distributed to other states that have expanded their Medicaid coverage. Actually, 31 other states that have expanded their Medicaid coverage.
So why haven't we expanded it here?
Well, there are those in our state legislature that feel like it's fiscally irresponsible. And the reality of it is, I believe it's mostly partisan politics.
How can it be irresponsible? If we're already paying for it, what's the problem?
That's exactly my point. Their contention is that if something fails, that if there is a flaw in the system, if for some reason the federal government can't afford to do it, or we can't afford to put our taxes into it, then this coverage will go away. The simple truth is, it's already taken care of in this legislation. If Missouri expands Medicaid and something in the system breaks and we can't afford to do it, we can opt out.
So basically, expansion of Medicaid is like the opposite of expansion of Obamacare.
Well, that's exactly right. The Affordable Care Act, Obamacare, will not come down, and it's not going to be expanded.
Right.
It really can't be expanded. It's a piece of legislation. It's a statute. It is a law, and it's a framework. It's a guideline for the sale of health care insurance. The expansion of Medicaid simply takes the money that we're currently sending to Washington, D.C. that's being used in other states and expanding it to the people in the state of Missouri.
So if you're elected, that's what you want to do. You want to expand Medicaid, and you're not even talking about Affordable Care Act.
No, I'm not. Medicaid it's two different things. It is really apples and oranges. Medicaid is something that's administered by the federal government through tax dollars. The Affordable Care Act is actually insurance that is purchased on the marketplace.